Okay, blank page 1, front and back, blank page, third page is blank. Set this face down onto the bed. Hand sanitizer. Okay. Hello, my name is Hunter. I'm going to be your student nurse from Saginaw Valley today. Can I get your name and date of birth?
Skylar Devonsky, 2299.
And then do you know what year it is?
2025.
And do you know where we are?
My house.
Okay. So patient is anal times 3, so I feel comfortable moving on with this assessment. Another question, do you have any allergies?
No.
Okay. So what we're going to be doing today is a head to toe, so it sounds exactly how it is, or it is exactly how it sounds. We move from your head down to your toe to check to make sure that all your body functions are working properly. Now before that, I do have a couple overview questions, if that's okay with you.
Yep.
Okay. First one is, do you have any past or current medical diagnosis?
No.
Any surgeries?
No.
Any relevant family history?
No.
And are you taking any medications?
No.
Any over-the-counter meds? Any herbal supplements, vitamin supplements?
No.
Okay. And then moving forward, we do have a couple personal questions, but I just want to reassure you that HIPAA is in full effect. So that means anything that is talked about in this room stays in this room. First one being, if at all, how often do you partake in smoking? This includes vapes, marijuana, and cigarettes.
I don't.
No. Okay. And then how often, if at all, do you partake in alcohol consumption?
I don't.
Okay. And then how often do you exercise?
3 to 5 times a week for 30 minutes.
Okay. And that lines up with the CDC recommendation of 30 minutes walking a day or 150 minutes a week. And then how is your diet? Do you get 3 meals a day, some snacks in between, all the food groups?
Yeah, I would say so.
Okay, perfect. And then the last question, are you in any pain today? 0 being no pain, 10 being the worst pain.
0.
0, okay. So after those questions, I feel comfortable going into the assessment. So before we begin the physical assessment though, I'm just gonna grab a quick set of vitals. First thing I'm gonna do is get your blood pressure. Do you have a preference on arm?
No.
Okay, I'm just gonna look for the right one here. So you're gonna feel a little squeeze when I put this on you. Just let me know if it's pinching you at all. Just lift this up here. I'm just gonna quickly check the camera angle. Make sure it's good. Okay. So I'm just going to find your brachial pulse here. Okay. And then you can just breathe normal. I'm listening with my diaphragm on the brachial pulse. So your blood pressure is 118 over 68, which is well within normal range, so we're okay there. Thank you. I'll set that. So the next vital set we're going to get is your pulse rate. So can I use the same wrist to get that, or same arm? So I'm going to go for your radial pulse, which is on your thumb side, and I'm just going to count this for a minute. Starting now. Okay, good there. Pulse is 80 and respiratory rate is 14. So both within the normal range. Any pulse between 60 and 100 is good. And any respiratory rate between 12 and 20 is good. So the next set of vital I'm going to get would be temperature, but I do not have a temp probe. So are you feeling any abnormal feverish chills? Any abnormal sweating or hot flashes?
No.
Okay, I'm just going to feel your forehead, cheeks. Okay. So I'm not feeling any warmth or coldness on your facial extremities. So I would say that your temperature is within normal range of 98.6 degrees Fahrenheit. So the final set of vitals, since we already assessed your pain, is at a 0, would be SpO2. So I do have an SpO2 reader here. But before that, I just want to inspect your hands for clubbing. So clubbing would be if there's decreased oxygenation to the tissues. Okay, I'm not seeing any. I'm just going to use this finger here. SpO2 is 98, so that's within normal range. Anywhere between 95 and 100 is good. Closer to 100% is better, which you are. So now that we got the vitals, we can go ahead and start with your head to toe assessment. Now normally we might go to head to toe, but I'm going to start at your hands, move my way up to your shoulders, to the top of your head, and then down to your feet. So it's okay if I take your hands now? I'm just going to look at your arms, feeling muscle symmetry. I'm not seeing any abnormal lesions, moles, or rashes on your skin. Temperature feels good. I do see you have a tattoo here. Did that heal up okay? Any problems with that?
No problem.
Okay. And then I'm just going to assess your fingers here. I see you do have darkly painted nails, so I'm just going to have you flip your hands and I'm going to assess cap refill on the tips of your fingers. Cap refill is symmetrical, less than 3 seconds. Symmetrical, less than 3 seconds. Symmetrical, less than 3 seconds. So you're good there. And then next I'm going to feel for your brachial pulse, if they're symmetrical and strong, and then your brachial pulse. So I'm just going to feel right here. Pulses are strong and symmetrical. Pulses are strong and symmetrical. And then I'm going to go ahead, if you could just push up when I push down on your shoulders. Okay, that was cranial nerve number 11. We'll get into the rest of those later, but that is your accessory cranial nerve. So next, I'm going to do some range of motion exercises on your arms. To start, could you have your arms at a 90-degree angle and just bend them like you're lifting weights? Good. And then do you know how to swim?
Mm-hmm.
Could you just do a forward swimming motion with this arm? Good. And then backwards. Good. And then can you do the same for this one? Good. And then backwards. Good. And next we're going to do some strength range of motion exercises. So I'm just going to push in. If you could just push out. Good. Push out when I push in. Or push in when I push out. Push up when I push down. Push down when I push up. And the last one, can you just rotate your wrist for me? Other way. Good. So your range of motion in your arms and hands look good. So next we're going to get into your cerebellar function. Could you start off by making an okay sign? Then middle finger, ring finger, pinky, back, and as fast as you can. Good. And next you put your hands on your thighs, flip them over, put them back. Now as fast as you can. Good. And then the last one is going to be nose to pen light. So if you can put your hand on your nose, or finger on your nose, touch the pen light, touch the pen, or nose. I'm sorry. Start over. Nose, pen light,
okay.
Pen light to nose to pen light, to your nose, pen light, nose, pen light. Good. So your cerebellar function is good, so no concern there. And then your range of motion is good, your pulses were good, skin looked good, cap refill is good. So now we can move on to your head assessment. First thing I'm going to do is just inspect your scalp, feel your lymph node on your back. Then I'm going to go to your ears, feel the rest of your lymph nodes. And then while I'm down there, I'm going to assess for tissue turgor, which is a sign of dehydration. I'm going to do your lymph nodes, and then we'll get to your eyes, nose, mouth, and then your face. So first thing I'm going to do is just assess your hair, your scalp. Everything looks good. Not seeing any flakiness or anything that would be concerning here. While I'm here, I'm going to feel your occipital lymph node. Let me know if you have any feeling of pain or tenderness there. Anything? Okay, you can go ahead and lift your head up. Next, I'm just going to inspect your ears. I see that your ears are pierced. Did you have any problems with those healing up?
No.
Just going to look behind them. Good. Check this one out.
Interesting.
Good. And then while I'm here, I'm going to do the rest of your lymph nodes. So I'm going to do your post-cervicular, pre-auricular. I'm going to touch your neck now and do submandibular, submental, cervical chain. And if you could just go like this and shrug your shoulders for me, I'm going to feel your, oh, we're a little tight back there. Do that again. Supraclavicular, clavicular, and I'm just assessing your tissue trigger here. It is non-tenting, so no sign of dehydration. Was there any pain or tenderness with any of those lymph nodes?
No.
Okay. So lymph nodes were non-palpable and movable, so everything looked good there. Next, we're going to do your two sinuses. First one is going to be your frontal, which is above your eye, brow, and then your mental, which is, no, maxillary, which is underneath your eye. So any pain or tenderness, let me know. Frontal, maxillary, anything there? Okay. So your lymph nodes and sinuses look good. Next thing I'm going to get into is your eyes. So with this, we would assess cranial nerves 2, 3, 4, and 6. 2 is optic, 3 is oculomotor, 4 is trochlear, and then 6 is abducens. Since we do not have a Snellen chart, we cannot do optic, which is eyesight. That is just like the numbers and letters of an eye doctor. Do you wear contacts or glasses? How often do you go to the eye doctor?
Once a year.
Okay, perfect. That is the recommended amount. So first thing I'm going to do is I'm just going to shine a light right about here to see if your eyes are reactive. First, before that though, I'm going to inspect your eyes. Could you just look down for me? And then look up. Good. Pupils are round. Sclera is white. Conjunctiva is red. So I'm going to just shine this light. If you could look at my badge, which is over here today. Good. And then I'm going to do individual pupil accommodation. Could you just look at my badge again? Good. Good. Both pupils were reactive to light individually and together. So the next thing we're going to do is the 6 cardinal fields of gaze test. So if you could just move your eyes only, follow my pen light. We're going to go in 6 directions. I won't end up at the same spot as we started, but try not to move your head. And I'll try not to put the pen light outside of your eye range. So we'll start here. We'll go up to the right, up to the left, out to the side, out to the left, down to the right, out to the right. Okay, so that was cranial nerves 4, which again was trochlear, so that's down and in. And then cranial nerve number 6 was also assessed with that abducens contralateral movement. And then cranial nerve number 3 was assessed, oculomotor, because your eyes were perla, which means that they are round, reactive to light, and accommodating, which we do have one more accommodating test. So if you just look at my pen light, look at my hand, pen light, hand, pen light, hand. Okay. That was near to far accommodation to make sure your pupils were dilating and constricting as necessary. So that concludes our eye examination. Next, we'll get into your nose. So this will assess cranial nerve number 1, which is olfactory. If you could just tilt your head back, I'm going to take a peek in there. Good. Mucous membrane is moist. I'm not seeing any deviated septum or polyps in there. Could you go ahead and plug one nostril with your finger, breathe in and out? Same with the other. Okay, if you just close your eyes, I'm going to waft something across and you just tell me what you smell. Yep. So again, that was cranial nerve number 1, which is your olfactory, and that is going to sense or be a judgment of your sense of smell. So that now is cranial nerve number 1. We were not able to assess 2. We did 3, 4, 6, as well as 11, which was the shoulder shrug early on. So next we'll get into your facial nerves. The first one, 5, is trigeminal. This is going to be sensory and motor. First thing I'm going to do is, if you could just clench your jaw, unclench, and clench. And then the next one is going to be sensory. So if you could just close your eyes and tell me where I'm touching with my pencil on your face.
Forehead, nose, cheek, other cheek, chin.
So your cranial nerve number 5 is all good. And then the next one is 7, which is your facial cranial nerve. So if you could just smile, frown, puff your cheeks, lift your eyebrows like you're surprised. Okay, that was cranial nerve number 7, which is again your facial nerve. So we've now assessed cranial nerve number 1, 2, 3, 4, 5, 6, and 7. And since you're responding to me, your cranial nerve number 8, which is your vestibulocochlear cranial nerve, I'm assuming that is half good. We'll assess that later on once we do balancing gait, once we get up. The next one we're going to do is your mouth. So this will be cranial nerve number 9, which is your glossopharyngeal, 10, which is your vagus, and 12, which is your hypoglossal nerve. So if you just open your mouth for me, I'm just going to inspect it a little. Good. It's moist. I'm not seeing any redness, any lesions. I see you have your tonsils. I'm not seeing any white or unilateral white spots, so no tonsil stones or signs of infection. Next, can you just lift your lip up for me? Good. Same with it down. Good. Teeth look good. Lips are symmetrical. So that is good. Next thing I'm going to have you do is I'm going to suppress your tongue with this tongue suppressor. If you just say ah for me. Good. So your gag reflex was good. Your uvula was reactive to that. And then next, could you just stick your tongue out? And then we go back and forth. Good. So that assessed all of our cranial nerves and they are all intact. So next thing I'm going to move on to is assessment of your neck. So I'm going to touch your neck slightly here. So if you just tilt your head up a little bit, your trachea is symmetrical and midline. Skin looks good there. So first thing I'm going to do is I'm going to palpate your carotid arteries individually, and I'm going to auscultate for bruits. So I'm just going to get my hand over here, palpating, and then pulse. Okay. So next I'm going to auscultate. I'm on my bell. If you could just hold your breath momentarily. Good. And then same on this side. If you could just hold your breath momentarily. Good. So I didn't hear any whooshing or anything of concern, so I'm not concerned about any bruise. So I've now assessed all of your upper extremities, and then your arms and your neck. So I am now going to move on to your back, and we're just going to assess your thyroid gland. So what that is, I'm going to reach around, push your trachea to the side, and have you swallow. And if I feel something, then you are at risk for hypothyroidism. If I don't feel anything, then you're all good. For that, I'm going to check my camera angle. Okay. So I'm just going to reach around with my right hand. It's going to be on your left side. And then if you just swallow when I say so. Go ahead and swallow. Good. I'm going to do the same on this side. Swallow. Good. I did not feel any distension of your thyroid gland, so I'm not concerned of any hyperthyroidism. So now I'm going to move on to your lung assessment. I'm going to move the camera angle if you just sit tight. Moving the camera angle, I have to unplug it because it was charging. Paper is upside down. Okay, warm in here. Alrighty, I'm just gonna untie your gown here. Let's move this over, and then I'm just going to check one more time to make sure that the angle is good. Good. Okay. So first thing I'm going to do when I'm inspecting the lungs, or assessing the lungs, I'm going to inspect. I'm inspecting your neck, symmetrical. I'm looking at your A to P ratio. It's 2 to 1, so I'm not concerned with any burial chest. Now, if you did have asthma or emphysema, then I'd be more concerned about that. I'm feeling temperature all around. Temperature is good. I'm not seeing any abnormalities in skin. Again, any lesions, rashes, or moles that would be concerning. I'm now going to palpate down to see where I'm assessing, because I don't want to be too far on the spine or too far on your shoulder blades here, so that I am not listening to bone. And then the last thing I'm going to do before I percuss and then auscultate is I'm just going to have you take a deep breath with my hands here. Good. So one more time, please. Okay. So lungs expanded bilaterally, so that is good. And I also just wanted to assess where your lung field might end, so that I'm not going too low and not hearing anything. So I'm just going to move your hair. Where are we at? There we go. Just half and half here so I can get to your neck. So I'm going to percuss, and then I'm going to auscultate. I'm going to do 6 spots on each side, doing a zigzag motion so I can compare. So I'm going to start right here. When doing this, I'm going to want to hear resonance. If I'm hearing any dullness, especially in the lower, I might be concerned for fluid buildup down there. And if I'm hearing flat, then I'm hitting a bone. So I'm not in the right spot. So I'm just going to start here. Hearing resonance, resonance 3, resonance 4, resonance 5, resonance 6, resonance 7, resonance 8, resonance 9, resonance 10, resonance 11, resonance 12. So we're good all the way through. Again, no dullness, so no signs of fluid buildup in the lower extremities. So now I'm going to do the same thing, but with auscultation.
I have to keep my head.
Yes, thank you. So as I move my diaphragm, I'm just going to have you take a deep breath, or my stethoscope, and put on a new spot. If you need a break, raise your hand, or just let me know, as I know 12 deep breaths in a row can be demanded. So I'm on my diaphragm. I'm just going to start at the same spot, and I'm going to listen for any crackles or wheezes. Crackles would be a sign of fluid in the lungs, and wheezes would be a sign of asthma. Go ahead and take a deep breath. Good. Deep breath. Good. Sounds are clear. Deep breath. Good. Sounds are clear. Deep breath. Very good. Sounds are clear. That was 4. Deep breath. Very good. Sounds are clear. 5. Deep breath. Good. Sounds are clear. That's 6. Deep breath. Sounds are clear. That is 7. Deep breath. Good. Sounds are clear. That is 8. Deep breath. Good. Sounds are clear. That is 9. Deep breath. Good. Sounds are clear. That is 10. And then deep breath for me. Good. Sounds are clear. That is 11. And then one more. Very good. So lung sounds are clear bilaterally. No crackles or wheezes. So I'm just going to tie you, or I'm going to leave you untied because we're going to lay down a minute, but I'll cover you up. And then I'm going to use my first sheet check. And we're still recording. So now, if you could just go ahead and lay down for me, I'm going to move the camera angle. I'll scoot up, you can use the pillow. Try to get it away. Alright, so we're going to get into our cardiac assessment. Before that, I just need to check for jugular vein distension. So I'm just going to take your pillow away momentarily and then take that away. And if you just look left for me, I'm looking for any distension of the jugular vein right there. Nothing seen. Look towards me. Same thing on this side. Nothing seen. You get your pillow back. Now, if I were to see jugular vein distension, I'd sit you up at a 45-degree angle and reassess if it stayed. So now if you could just pull your gown down just about to the top of your rib cage. Got you tucked in there. Okay, a little more, just right there. You want your arms out?
It doesn't matter.
Good right there. Comfortable? Okay. So first thing I'm going to do is I'm going to inspect. Temperature of skin looks good. Patient is symmetrical there. I'm not seeing any abnormalities in skin, any, again, rashes, lesions, or moles to be concerning. So now that I've inspected, I can go ahead and auscultate your 5 heart sounds. The acronym for this is APTMAN, so your aortic valve, your pulmonic valve, your Erb's point, which is going to be the loudest sounds of the heart, your tricuspid valve, and then your mitral valve, which we will stop there, and that is mid-clavicular down the nipple line. We'll stop there, and we'll take your apical pulse for a full minute. While I'm doing this, I'm hearing for S1, S2, lub-dub, and then I'm going to flip it to my bell, and I'm going to be listening for any murmurs. Hearing nothing is good. As I'm doing this, I'm going to be poking at you a little bit, counting ribs and intercostal spaces. Just a fair warning. So first thing I'm going to do is, this is the patient's right side, closest to me. I'm going to start at her clavicle, and I'm going to feel a space, rib 1, space, rib 2, space. So this is where the aortic valve is. I'm going to recount because I don't have my stethoscope on. And I'm on my diaphragm, so clavicle, space, rib 1, space, rib 2, space. With my diaphragm off the sternum, I'm listening, hearing lub-dub, S1, S2. I'm now going to flip it to my bell. Hearing nothing, so no murmurs heard. So now I'm going to flip it back to my diaphragm, and I'm going to count down the same 2 spaces to your pulmonic valve on the patient's left side, farthest away from me. Clavicle, space, rib 1, space, rib 2, space. I'm on my diaphragm, listening, hearing lub-dub, S1, S2. Flipping to my bell, listening, hearing nothing, no murmurs heard. Maintaining my point of contact, I'm now going to rib 3, space 3. This is your Erb's point. This is going to be the loudest point of the heart sounds. Listening with my bell. Hearing nothing, no murmurs heard. Flipping to my diaphragm. Hearing S1, S2, lub-dub. Maintaining my point of contact. This is intercostal space 3. Rib 4, space 4. So I'm on my diaphragm still. Going to reach in. Place my diaphragm down. Listening. Hearing S1, S2, lub dub. I'm now going to flip my bell. Flip over to my bell. Hearing nothing, no murmurs heard. So at this point, I'm just going to recount to make it a little easier on myself to find that mitral valve. And then we'll take your apical pulse. Clavicle, space, rib 1, space, rib 2, space, rib 3, space, rib 4, space, rib 5, space. So I'm on rib 5, space, intercostal space 5, gonna go mid-clavicular here. Going to just reach under. And I'm right there. I'm listening with my bell, listening right here. Hearing nothing, no murmurs heard. Flipping to my diaphragm. Lifting up slightly, flipping, listening right here. And now I'm going to listen for a full minute. Starting now. Apical pulse was 72. Sorry if I'm yelling, I can't hear with this thing on. Okay, so that will complete your cardiac assessment, so we can just go ahead and cover you back up. Get your arms back in there. Good, okay. And then I'm just gonna have you lift up to see your stomach here. You got it all tucked in. Right up there, and then I'm just going to roll this down one time there. Okay. And then I'm going to switch my camera angle. Still recording, which is good. Then I'm going to get to my abdomen. And we're good there. Okay, so with abdomen, there's a very specific order on we want to do things. First one being inspection. So I'm just looking for symmetry. Abdomen is symmetrical. I'm not seeing any distension or bulging out of the stomach. I'm just going to come down here. Again, look, could you just hold your breath for a minute or a second? Good, I'm seeing the abdominal aorta pulsate. Next, I'm going to make sure that I'm seeing at the end of the bed here. Okay, and then could you just hold your breath momentarily again? Good. So abdominal aorta is pulsating. Okay, so we are good to move on after inspection. First thing we're going to want to do is auscultate. And after auscultation, we're going to palpate, after auscultation, we're going to percuss. And then finally, we're going to light palpate and then deep palpate. So the way I'm going to do your auscultation, I'm going to start in the right lower quadrant, listening for bowel sounds, gurgle, gurgle, right upper, left lower. And then I'll auscultate your arteries in your stomach, and then I will get to percussion. So I'm on my diaphragm. I'm going to start in the right lower, listening for bowel sounds. Hearing 5 bowel sounds, gurgle, gurgle, moving to the right upper. Hearing 5 vowel sounds, gurgle, gurgle, moving to the left upper. Hearing 5 bowel sounds, gurgle, gurgle. And then the left lower here. Hearing 5 bowel sounds, gurgle, gurgle. So bowel sounds are active times 4. Next thing I'm going to do is I'm going to find your abdominal aorta. So I'm going to look for your xiphoid process up here. Belly button, move to the middle. I'm now switching to my bell. Putting that on my point on the abdominal aorta. And I'm just listening for any whooshing and bruise. I'm hearing nothing, so no whooshing, so no bruise heard. Next, I'm going down to my renal arteries, which are down and out a little, still above the belly button, umbilical. Listening for any whooshing. No whooshing heard, no bruise heard. Moving directly across, same spot. Listening for any whooshing. No whooshing heard, no bruise. Next, I'm going to go down to the iliac artery. Listening for the same thing. Hearing nothing, no bruise. Going directly across. Hearing nothing, no bruise. So that will be the last auscultation until we get into the femoral artery, which I will do once we assess our legs. So now that I've auscultated, I'm going to percuss. I'm going to do the same order as before, right lower, right upper, left lower, and I'm going to be listening for tympani all the way around. So I'm going to percuss. Hearing good tympani. Next, I'm going to assess where your liver line is. So I'm going to start in the right lower. Tympani, 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 dull. So your liver is right about there. Okay, so now that I've percussed, I'm going to palpate. I'm going to start with light palpation. If there's any pain or discomfort, let me know. So I'm just going to start in the right lower again. I'm light palpating. Right upper, light palpation. Left upper, light palpation. Left lower, light palpation. Any pain or discomfort there?
No.
Okay, I'm going to go into deep palpation now again. Same thing. Deep palpation. Deep palpation. Deep palpation. Deep palpation. Any pain or discomfort there?
No.
Okay, and I want to note, because my face is not seen, that I was looking at patient's face for any grimacing or wincing. So that will complete our abdominal assessment. We can just lower this down a little bit, and then we'll get into our leg assessment. I'm just going to move the camera angle again. Make sure we got our feet in there. Okay. So first thing I'm going to do, as always, I'm going to inspect the legs. I'm not seeing any color or any discoloration. No edema noted. Next, I will get into feeling muscle tone. Muscle tone is symmetrical. Temperature is good all the way through. Not seeing any abnormalities in skin. Again, color is good all the way through. Next thing I'm going to do is I'm going to palpate your femoral arteries. So make sure that they're in there. Okay. So I'm going to palpate your femoral arteries. If you could just lift your legs up and then kind of make like a frog-like position. Good. Okay, I'm going to start on this side, and then I'm going to auscultate this side. And I'm going to feel for if they're strong and symmetrical, and then I'll move my hand and auscultate that side. So I'm just reaching in here, going down and in. All right, there we go. So I'm going to auscultate. On my bell still. I'm listening right here. Hearing nothing, no bruise heard. Pull that out. I'm going to now hold my spot. Switch my hands so I don't lose it. Feel on this side now. Femoral arteries are strong and symmetrical. Okay, I'm going to hold my spot on this side now. Stop taking this thing out. Okay, I got it. I'll go back to it. No, you're good. You're good. I got it. I know where it is. Again, I'm on my bell. Got it. I'm right here. I'm listening right here. No whooshing heard, no bruise heard. Pull this out. Okay, you can go ahead and rest your legs normal. Thank you. And then I will cover you up a little more. So the next one, we're just going to do your popliteal arteries, see if they're strong and symmetrical, then your posterior tibialis artery, and then your dorsal artery. So you just lift your legs up one more time for me. So open the right about there. Just gonna reach in here. Popliteal arteries are strong and symmetrical. Next, we're going to get into you're good now. Posterior, check the camera. Posterior tibialis here. They're strong and symmetrical. And then the dorsal, which is right around, right kind of diagonal from your big toe there. Dorsal is strong and symmetrical. So all of your arteries are good, or pulses on your legs are good. Next thing I'm going to do, second to last thing for your legs, I'm just going to inspect in between the toes. A couple fuzzies, but nothing out of the ordinary. And now I'm going to assess for capillary refill on your toes. So, shade. Cap refill is symmetrical less than 3 seconds, symmetrical less than 3 seconds, and symmetrical less than 3 seconds. Now you do have nail polish, I was able to see, but I will assess it on the tips of your toes here to double check. Symmetrical in less than 3 seconds, symmetrical in less than 3 seconds, symmetrical in less than 3 seconds. So cap refill on your toes are good. So the last and final test we're going to do on your legs is point localization. So if you just close your eyes, I'm going to poke you with the sharp and then poke you with the dull. It's not going to hurt. Sorry, poke is not a good word. If you just close your eyes, this is sharp and then this is dull. Can you feel the difference? Mm-hmm. Okay. So again, with your eyes closed, could you just tell me if I'm poking right thigh sharp, left knee dull? Okay, I'm going to start here.
Left thigh dull.
Can you say it a little louder?
Right thigh sharp. Right calf or shin sharp. Left knee dull. Right knee sharp. Left shin sharp. Right foot dull. Left foot dull. Bottom of left foot dull. Bottom of right foot dull.
Okay. So you got a perfect 8 out of 8 on that. So you're all good there. So I'm now going to do my second sheet check before we sit up. Camera angle on me. Okay, so if you could just sit up at the end of the bed where we started, I'm going to move the camera angle. Just don't get off the bed quite yet. gonna get there. I'm just gonna plug it in so it doesn't die on me. Okay, still recording in the camera. Okay, so next what we're gonna do before we stand up, we're just gonna assess your range of motion on your feet and then your patellar reflex, or feet and legs. So first off, could you just inch a little bit closer to the end of the bed and then extend this leg out and then put it back down. Same with this leg out, put it back down. Next, can you roll your ankles in a circle? Same thing other way. Good. And then I'm going to have you push up while I push down while I push up, push out while I push in while I push out. Okay. Range of motion is good on your legs, so now I'm going to assess your patellar reflex. If you just close your eyes, I'm going to poke around and I'm going to thump you a little bit. And then we should get a little kick out of it. Try that again. Good, we got a little in there. Same here. Well, that's better if I go to the side so I don't hit the other knee twice. Good. Okay, so your patellar reflex is good, range of motion is good. So now we'll go ahead and put our socks on. Got them. And then we'll put our shoes on. We'll get up, do a Romberg test, walk a little, and get any questions, and then do a Braden scale, and we'll be done. I can go ahead and tie your shoes since I didn't tie your gown yet. No, let me tie your gown.
I got this shoe.
I'll get it for you. This one for you.
Oh.
Yeah, that's sorry. Gotta start it first. I don't teach you that in nursing school. Always double knot. Alright. So you're okay to stand up now that we have shoes on. Go ahead and stand up. I'm just going to check the camera angle. Are you feeling any dizziness or lightheadedness as we're standing up?
No.
Okay. So first thing we're going to do is a Romberg test. So I'm going to have you do feet shoulder width apart, matching me. Hands out to the side. And I'm just going to close your eyes for 10 seconds. I'm here in case you get any swaying. Starting now. Okay, I did not see any swaying or risk of falling, so I'd give you a negative Romberg test. So you're good there. And then if you could just take a step towards me. Okay, so first thing we're going to do is we're just going to walk that way a little. Normally, I'm going to be here in case you fall. Go ahead, about 4 or 5 steps. That's good there. Okay, next we're going to come back, but we're going to be walking heel to toe. Got it? Very good. That's good. And you are okay to sit down if you'd like. So with that, do you have any questions for me as we complete our assessment?
No.
Okay. So with that, I would give you a perfect Braden score, scale score of 23. You have proper nutrition, exercise, mobility, no risk of friction or shear, and you have no incontinence, so I'd have no worries of moisture on your skin. So I give you, again, perfect score of 23 on the Braden scale, and that's just a risk of pressure ulcers, so I wouldn't have any concern of you developing a pressure ulcer. I'm going to do my sheet check one more time, and then we should be good to go. Okay, one more time. Any more questions for me before we complete?
No.
Okay.